Hello, my name is Jessica Cooks, and today I will be completing a comprehensive health history exam for MSN 572 Advanced Health and Physical Assessment across the lifespan with United States University. I have a volunteer that has agreed to complete the health history exam and share information. Do I have your consent to record you while I ask you personal questions about your health history, and lifestyle, and upload this video on YouTube and possibly share the information with faculty at United States University as well as other students?
You have my consent.
Thank you. And as we begin, can you verify your name and date of birth?
That would be Jack Smith, 4/26/1992.
1992. So that makes you how old, Jack?
28 years old.
28. Okay. And how did you get to the clinic today?
I drove my car.
You did drive your car. Okay. How would you like to be addressed?
Jack is just fine.
Jack, I'll keep that in mind. How do you identify?
As a black male.
A black male. Okay. Did you come to the clinic alone today?
Yes, I came alone.
Okay, and I would like for us to discuss your access to healthcare. How would you describe your access to healthcare?
I think it's pretty close, pretty good. This place is right down the street from my house.
Okay, and what about your access to pharmacies?
I have one a couple blocks over, so I have access to both.
Okay, so it does look like you do have access to healthcare. That's pretty good. How would you describe your overall health?
My overall health is pretty good.
When you say pretty good, would you compare your health to 3 years ago as better, worse, or the same?
For the last 3 years, I would say it's the same.
It's the same. And when was your last physical exam?
About a year ago.
About a year ago. Did you have any health issues or concerns that the doctor had to address at your last physical exam?
No, none that I can think of, no.
Okay, and have you had any new health issues or concerns since your last physical exam?
No, none at all.
Okay, so thinking about that last physical exam again, did the doctor recommend any tests or lab work that has not been performed?
No.
No? And did you have any lab work drawn at your last physical exam?
No lab work was drawn.
Are you taking any medications? Did the doctor prescribe you anything to take?
No, I don't take any medications. Haven't got any prescriptions for medications.
Okay, and do you have any allergies to food?
No allergies to food whatsoever.
No food allergies? What about any environmental allergies? Like, do you have any allergies to latex or anything in the environment?
No, nothing I can think of.
Okay, do you have any medication allergies?
No medication allergies at all. No, I'm not allergic to any medication.
Okay, have you had any reactions to any medications?
No reactions whatsoever.
Okay, so it looks like you don't have any allergies at all. So let's think a little about your childhood. Have you had any childhood illnesses?
No childhood illnesses.
As a child, did you ever get the measles or chickenpox or any of those diseases?
No, I was a pretty healthy kid.
Okay, no hospitalizations as a child?
No, not as a child.
Any surgeries as a child?
None I can think of.
Okay, so you do sound like you were pretty healthy as a child. Did you get your childhood immunizations?
Yes, I received all of them.
Okay, and while we're talking about immunizations, have you had any immunizations as an adult?
My doctor told me to get the tetanus booster, and that was about 3 years ago.
Okay, so you did get the tetanus booster 3 years ago.
Yes.
Any other immunizations?
I do get the flu shot once a year. The last time I got it was back in November.
Okay, very good.
Yes.
Do you get any other immunizations?
No other immunizations that I can think of. I know I just go to my physical once a year, and that's about it.
Okay. Have you had any hospitalizations as an adult?
As an adult, no, none at all.
No, any illnesses you can think of as an adult?
No illnesses as an adult, no. Pretty healthy.
Okay, never had the flu, any colds or anything like that?
Well, I did have the common cold. That was about 3 years ago.
Okay, and did you take any medications or treatment or anything for that?
I think I took some over-the-counter Robitussin. That was about it.
Okay, and have you taken any of that Robitussin since that cold 3 years ago?
No, nothing at all.
Okay, so you don't take any medications over the counter now, or do you take any medications over the counter now?
No, I don't take any now.
Anything for any aches, any pains, any coughs, or anything like that?
No, nothing at all.
Okay, do you use any creams or anything like that?
No, no creams.
Okay, so it does sound like you don't take any medications at all. Is that correct?
Correct.
Okay, can you tell me a little bit about your family history, just your health history of your family members?
So my mom, she is 59 years old. She has a history of high blood pressure.
Okay.
My dad, he's about 60 years old. He has a history of high blood pressure, diabetes. He was diagnosed around 50 and has high cholesterol as well.
Okay, and what about your grandparents?
Well, my mom's mother, she died of a heart attack at the age of 89, which was like 15 years ago. And my other grandparents, I don't know their medical history.
Okay, thank you for sharing that with me. Do you have any siblings?
I have one brother. He's 32 years old, and he's pretty healthy.
Okay, thank you so much for sharing your family health history. It really helps to get us a picture of what things you may be at risk for, which things kind of run in families. You understand that?
Yes, I do.
Okay, so thank you for that information again. Now, do you smoke?
Oh, no, I don't smoke at all.
Okay, you ever use tobacco products or nicotine?
Oh, God, no.
No, have you ever tried marijuana?
No, nothing at all.
Ever tried any illicit drugs?
Oh, no.
Okay, do you use any alcohol?
Alcohol, that I do use. So I drink 1 to 2 bottles of beer when I watch the football game once a week when I'm not at work. And then maybe 1 bottle of beer and 1 to 2 shots of tequila when I'm at social gatherings, birthday parties, things like that.
Okay, so how would you describe your drinking habits? Would you say excessive?
No.
Have you ever had to have treatment due to alcohol use?
No treatment at all.
Okay, have you ever had a DUI?
No, I haven't had a DUI. No.
Okay, and you did say you have 1 beer and maybe 1 or 2 shots of tequila when you go to social gatherings. How often is that?
That's once maybe every 2 to 3 months.
Once every 2 to 3 months? Okay, thank you so much for sharing that information with me. Do you have any family history of alcohol abuse or drug abuse?
My family, no history of alcohol or drug abuse in the family at all, no.
Okay, so we'll move right along past that. I appreciate that information. Do you exercise?
Well, I stopped exercising about 5 years ago. I used to go to the gym. So, no, I don't exercise.
You currently don't? So how would you describe your physical activity?
Well, I don't have a regular exercise routine, but at work, me working as a paramedic, I definitely work 3 times a week, 12 hours a day. It requires me to stand a long time, a lot of walking, and I have to frequently lift over 50 pounds while I'm at work.
Okay, so it sounds like you don't have a regular exercise routine, but you're pretty active at work.
I would say so, yes.
Okay, so let's talk a little bit about your diet. Can you describe what type of foods that you eat?
So I eat some protein, red meat, pork, chicken. I do eat some carbs. I don't eat vegetables like I should. My water intake could be a little bit better. Drink like maybe 1 or 2 Cokes a day. Yeah.
Okay, so it seems like you're able to identify that you should eat more vegetables and drink more water.
I definitely should. I'm guilty of that.
Okay, those are 2 things that's very important with your diet. So now that you know that, just keep it in mind and just try to add it to your daily routine. Just drinking more water when you're at work or that's when you do the most physical activity. So it's important to stay hydrated. And then you definitely want to increase those vegetables. So what about salt? Do you think you take in a lot of salt?
Guilty as charged. I do eat a lot of table salt with my food,
Okay.
and I cook with seasoned salt.
I see. So that's definitely something you may want to try to reduce in your meal intake. Just looking at your family history with the hypertension or high blood pressure, That table salt, if you can get rid of it, I recommend that you do. But if not, I just recommend that you definitely try to work on decreasing it or choosing foods that's low on sodium. As we're getting closer to the end, we'll talk a little bit more about that, okay?
Okay.
And is that something you're open to? Decreasing the salt intake, increasing the vegetables, drinking more water.
Yeah, I want to be here as long as I can.
Okay, what about losing weight?
No, I don't think I should lose weight.
Okay, you're not ready to lose weight yet?
No, not yet.
Okay, but that's something, again, we'll talk about that as well. So just moving right along, do you have any specific concerns about your sexual history that you would like to discuss?
No, I don't have any concerns at all.
Okay, have you experienced any sexual trauma?
No sexual trauma, no.
Okay, when was the last time you had sexual intercourse?
It was about 3 years ago. I'm practicing abstinence.
Oh, you are practicing abstinence. Okay, how many sexual partners have you had in the last 5 years?
I've only had one sexual partner since I was 18 years old.
Okay, and was that the first time you had sexual intercourse?
Yes.
Oh, I understand. So what gender is your sexual partner?
Female.
Have you ever had a sexually transmitted infection?
No, nothing at all.
No, and do you have any children?
No children yet.
No? Okay, and what is your current occupation?
I'm a paramedic. I got my associate's degree when I got my paramedic license, and then we had some additional training for the job as well too.
Okay, I just want to be sure I'm clear. Your highest level of education you completed was an associate's degree?
Correct.
Okay, have you ever been in the military?
No military experience, no.
No, and what is your current living situation?
Currently right now, I live at home. I'm in a 1-bedroom apartment. I live on the first floor. No pets and no family member.
Okay, do you consider yourself to be spiritual?
My spiritual affiliation would be Christianity, yes.
You're a Christian? Okay, and does your religious beliefs affect your health decisions?
No, not at all.
Okay, does your religious beliefs play any part in what you eat or how you eat?
No, not at all.
Okay, let's talk a little bit about safety. You said that you drove here. How would you describe your driving habits?
I don't text and drive. I don't drink and drive. I wear my seatbelt all the time when I'm driving. I even have a feature on my phone that is a do not disturb. It disables my phone while I'm driving. I think I'm a pretty safe driver. I don't want to mess with my discounts.
Okay, I definitely understand that. Okay, do you own a gun?
I do not.
Okay, are there any habits that you feel you have that can be considered unsafe?
Nothing I can think of, no.
Okay, well, thank you so much for sharing that information with me. So you did describe your overall health as good. Do you have any health concerns that you would like to discuss?
At this point, no, I don't.
Okay, so I'm going to ask you a few questions just to get a better picture of your different body systems. So these questions are specific to each body system. So if you think of anything or you want to go back to anything, just let me know. We can do that. Okay, so overall, have you had any weight changes in the past year?
Well, over the last 5 years, I've gained about 15 pounds.
You've gained about 15 pounds. Have you changed anything in what you eat or your physical or activity level?
Well, I stopped going to the gym about 5 years ago.
You did mention that.
But I haven't changed. What I eat is still the same, and my physical activity is the same. Just go to work.
Okay, so that weight gain probably has to do with the less activity. So you may want to try, if you're not ready to work on losing weight, you may want to focus on changing what you eat. That can play a big part in controlling your weight. So anything else about your weight, anything else about your daily activity, or anything that you would like to share?
No, not at this point, no.
Okay, how many hours of uninterrupted sleep do you get each day?
Probably between 6 to 8 hours.
About six to eight. Do you feel like that's adequate sleep? Do you feel like you're fatigued a lot? Any weakness or any of those things?
No, I believe that's an adequate amount of sleep.
Okay, so you don't experience any weakness or fatigue?
No.
Okay, so do you ever have any headaches?
No headaches, no.
No, have you ever had a head injury?
No, I've never hit my head, no.
Any dizziness or lightheadedness?
No dizziness, but I do get lightheaded if I change positions quickly.
Okay, that's pretty interesting. When you're changing positions, especially in your line of work, it's very important to change positions slowly just to give your body an opportunity to adjust. But that's still not something normal. So when did this start?
I can't really pinpoint when it may have been over the last years, or I may have always had it. It's something that it goes away very quickly. It's only for a couple of seconds.
Okay, does it interfere with your ability to do your job?
No, nothing at all. It happens. I move, change positions. I feel it for a couple of seconds, and it's gone.
Okay, so you're saying it goes away without any treatment or intervention.
Correct.
Okay, I still do want to do a blood pressure for you. It's called orthostatic hypotension. I apologize. So to check for that, I want to have you stand and we'll check your blood pressure. I'll have you sit and we'll check your blood pressure, and I'll have you lie down. We'll have our medical assistant do that when we're done with the interview, if that's okay with you.
Yeah, that's fine.
Okay, yeah, that's just something we want to look just a little bit more into. Okay, and I see that you're wearing glasses. Are those reading glasses?
No, these are seeing glasses. If I take these off, I probably wouldn't even know who you were.
Okay, how long have you worn glasses?
I've been wearing glasses since I was about 10 years old.
Oh, I see. Have you had any changes to your prescription?
During my teenage years, my prescription got increased a little bit stronger, but since about 18 years old, I haven't had a change in my prescription.
Okay, do you experience any redness, itching, drainage, or any of that from your eyes?
No eye infections, anything like that. Nothing's wrong with my eyes. I don't experience that.
Okay, when was your last eye exam?
December of 2020. It's 2021 now. Yeah, 2020.
Okay, and when you're wearing your glasses, do you have any double vision, blurred vision, or any difficulty seeing?
No, clear 2020 vision.
Okay, and let's talk a little bit about your ears. Do you have any difficulty hearing?
Huh? No. No difficulty here.
Any ringing in the ears?
No ringing at all, no.
Any drainage from your ears?
No drainage.
Any excessive earwax?
No.
Okay, do you experience any nosebleeds?
No nosebleeds.
Runny nose?
No. Runny nose, no.
Any difficulty smelling?
No.
Okay, and what about your throat? Any problems with your throat? Difficulty swallowing, hoarseness, soreness in your throat?
No pain, no hoarseness, or difficulty swallowing at all, no.
Okay, do you have any missing teeth?
No, I have all of my teeth.
And do you brush your teeth regularly?
3 times a day.
Okay, and do you have any bleeding from your gums or any bleeding from your teeth when you brush?
No.
Okay, any problems at all with your teeth?
No.
No? When was your last dental exam?
December of last year as well.
December of last year? Okay, and did the dentist recommend any treatments or recommend anything?
Flossing, that's about it.
Okay, do you floss?
I do, I floss.
Oh, I see. Okay, and do you shave yourself?
I do, I shave.
When you shave yourself, do you ever feel any lumps or soreness on your neck or throat?
No, nothing at all.
Okay, and do you ever experience any chest pain?
No chest pain, no.
What about heart palpitations?
No heart palpitations, no.
No, do you ever experience any difficulty breathing when you're lying down?
No.
Okay, what about with activity? Any difficulty breathing with activity?
No, nothing at all.
And what about at rest?
I breathe just fine, no.
Okay, do you have any shortness of breath?
No, ma'am.
Any coughing?
No coughing, no.
Any wheezing?
No wheezing at all.
Okay, and how would you describe your appetite?
I think I have a pretty healthy appetite, so it's pretty good, yes.
Okay, and when you say a pretty healthy appetite, does that mean you eat 100% of each meal?
Yes, if 101%.
Okay, do you snack in between meals?
I do.
Okay, has your appetite changed in the last year?
No.
What about the last 3 years?
No, it stayed the same.
Okay, any nausea or vomiting?
No nausea, no vomiting.
Any discomfort after you eat?
No.
When was your last bowel movement?
Today, actually.
Okay, do you have regular bowel movements?
Every single day.
You do go every day. Have you ever noticed any blood in your stool?
No blood in the stool, no.
Have you experienced any diarrhea, loose stools?
No diarrhea or loose stools, no.
Okay, any urinary frequency?
No.
Any difficulty urinating? Pain on urination?
No pain.
Have you ever noticed any blood in your urine?
No, ma'am.
Have you experienced any episodes of incontinence?
No incontinence at all.
Okay, and it sounds like you have been doing a lot of heavy lifting for many years. Have you ever been told you had a hernia?
No, no hernias.
Any penile discharge or discomfort, during sex?
No, no discomfort or discharge at all, no.
Okay, no discharge during or after sex.
No.
Do you have any joint pain or stiffness?
No, I do not.
Have you experienced any back pain?
No.
None during your shifts or any after your shifts?
No, no back pain at all.
Okay, with a job that requires heavy lifting, it's important that you use proper body mechanics. Is that something that you're aware of?
Oh, yes. I've been trained very vigorously in our company that I work with. We have frequent in-services about body mechanics, hurting your back. So I'm pretty proficient in it. I use proper body mechanics when I lift patients or lift things all the time.
Okay, I'm very glad that you're aware of that and that's something that you take serious. You definitely don't want to get a back injury or injure yourself or your patients in any kind of way. Have you had any broken bones?
Oh, now that you say that, I know that you asked me earlier, I can remember now. When I was a child, so about 8 years old, the summer of 2000, I injured my index finger. I broke it playing softball, and I was hospitalized.
Okay, and what treatment when you were in the hospital did they do for that broken finger?
Surgery.
You did have surgery?
Yes.
Okay, any other treatments for that broken finger?
No.
No, and does that broken finger cause you any problems today?
No, not at all.
No, so that finger is healed.
Yes.
Any other broken bones or experiences with anything being broken or surgery that you can recall?
No, no broken bones, no fractures, no surgeries.
Okay, have you experienced any falls?
No, no falls.
Never fallen down at work or anything like that?
No.
Okay, do you get any leg cramps or calf pain?
No, none at all.
Any changes in the veins in your legs?
No, no changes.
Okay, being a paramedic, I believe you work outside a lot, is that correct?
That is safe to say, yes.
Okay, any color changes in your fingertips or toes during cold weather?
No, I don't recall any changes in my fingertips or my toes during the cold weather.
No, okay, and do you have any open wounds on your skin?
No, none at all.
Any excessive dryness or flaking to your skin?
No, no excessive dryness or flaking.
Any moles that pose any concern to you?
No, none I can think of.
Okay, any concerns with your skin at all that you can think of?
No.
No, have you ever experienced seizures?
No, I haven't experienced a seizure personally, but I do have patients that have seizures. It seems pretty scary.
Yeah, that definitely can be pretty scary, I agree. Have you ever experienced fainting or syncope episodes?
No, none at all.
Any loss of consciousness?
No.
Changes to your memory?
No, ma'am, no.
Okay, any changes to your mood?
No, my mood's just fine.
Okay, you definitely have a sense of humor. Okay, do you ever experience any lack of interest in activities?
No, nothing at all.
No, do you ever feel hopeless?
No.
Have you ever felt depressed?
No, ma'am, no.
Have you ever had thoughts of suicide?
Oh, God, no.
Have you ever felt angry to the point where you wanted to harm yourself or others?
No.
Okay, so have you ever had a blood transfusion?
Oh, no, I've never had a transfusion, no.
You ever noticed any unexplained bruising on your skin?
Well, when I first started as a rookie, when I was a paramedic, I used to bump my arms and legs against the stretcher, but I'm experienced now, so that doesn't happen at all.
Okay, so I just want to clarify, you don't have any unexplained bruising or bleeding or anything like that now. That's something you don't currently experience.
Correct.
Okay, well that's good to know. You're being more careful and just watching out for that. Have you ever been diagnosed with anemia?
No, I have not.
Okay, any blood disorders that you know of?
Not that I know of, no.
Do you have any heat or cold intolerance?
I do not like to be hot. I prefer to be cold, but I don't think I have intolerance to either heat or cold, no.
No. Okay, do you have any excessive thirst?
No excessive thirst.
Excessive hunger?
I have a big appetite, but I wouldn't call it excessive.
Okay, do you feel like you urinate a lot?
No.
No. What about at nighttime? Do you get up and go to the bathroom a lot?
I don't. I kind of like sleep through.
Okay, because I was going to ask, is your sleep ever disturbed by having to go to the bathroom or urinate?
No.
Okay, any changes in your glove or shoe size?
Even with the weight gain that I've had over the past 5 years, my shoe size and my glove size has remained the same.
Okay. Do you have any seasonal allergies?
I do not.
Working as a paramedic or in your personal life, have you ever been exposed to HIV?
No HIV at all.
No. Have you ever been exposed to hepatitis B?
Come to think about it, so my doctor, or not my doctor, but when I first started to work at this job, I got the hepatitis vaccination. It was a series of 3 shots, I want to say,
Okay.
and that was back in 2017.
Okay, so just to be clear, in 2017, you did get the hepatitis B vaccination?
Yes.
Okay, so that was my last question. It concludes all of the questions that I had today. I'm going to go over your information that I collected, and I'll get a better idea if we need to start any treatments or if there's any further steps that we need to take to keep you more healthy. So just from the information I collected now, I do want to run some check some blood, run some labs on you so that we can further look into things like just to make sure the diabetes is not a risk for you, and just the overall health, see how your kidneys are functioning. And I do want to have them just stick your finger and check your blood sugar today just to see, just to get a baseline of where you are. I looked at, normally you go once a year to the doctor, but just because we do have a few things that I want to make sure we're getting a control of, I want you to come back in 3 months and check up with me. Okay? So that'll be the one thing that you do different. We'll come back in 3 months. We'll recheck your blood values. We'll, just kind of see if there's any changes or anything we need to address. Do you have any questions for me today?
No questions at all.
Okay, and lastly, I am going to recommend that you do see a dietitian. I just want you to make better food choices, because according to your BMI, you would be considered obese, and that's something that puts you at higher risk for complications with your heart and diabetes, and we want to get a hold of that before it gets out of hand and causes problems. Is that okay with you?
That's fine.
Okay, thank you so much for your time today, okay?
All right. Bye.